Depakote tablets is used to treat seizure disorders, certain psychiatric conditions, manic phase of bipolar disorder, and to prevent migraine headaches. It works by restoring the balance of such a natural substance as neurotransmitters in the brain. Indications. Depakote affects chemicals in the body that may be involved in causing seizures. Depakote is used to treat various types of seizure disorders. This medicine is sometimes used together with other seizure medications. Depakote tablets and capsules are used to treat seizures in people with epilepsy who are at least 10 years old. The tablets are sometimes used together with other seizure medications. Depakote tablets are also used in adults to prevent migraine headaches or to treat manic episodes related to bipolar disorder, manic depression. How to use. Always take Depakote exactly as the doctor has told you. Check with your doctor or pharmacist if you are not sure. Depakote treatment must be started and supervised by a doctor specialized in the treatment of bipolar disorders. Your doctor will decide your daily dose. If you feel the effect of a medicine is too weak or too strong, don't change the dose yourself, but ask a doctor. Take this medicine by mouth. Swallow the tablets well with a drink of water. Don't crush or chew them. Take Depakote with or after food. This will help to stop the feelings of sickness that may happen after taking Depakote. Adults, including the elderly. Starting dose is 750 mg on the first day. This is usually taken as 2 or 3 divided doses. The usual dose is then increased to 1000 to 2000 mg each day. Your doctor may decide to increase your dose depending on the illness. Patients with have kidney problems. Your doctor may decide to adjust your dose. Children and adolescents. Depakote should not be used in children and adolescents under 18 years of age for the treatment of mania. Contraindications. Don't take Depakote if you are allergic, hypersensitive to valproate sodium or to any of the other ingredients of Depakote. Signs of an allergic reaction include a rash, swallowing or breathing problems, swelling of your lips, face, throat, or tongue. You have liver problems, or you or your family have a history of liver problems, especially if caused by taking medicine. You have a rare illness called porphyria, which affects your metabolism. You have a known metabolic disorder, i.e. a urea cycle disorder. You have a genetic problem caused by a mitochondrial disorder. You are pregnant. If you are a woman able to have a baby, you must not take Depakote unless you use an effective method of birth control contraception at all times during your entire treatment with Depakote. Do not stop taking Depakote or your contraception until you have discussed this with your specialist. Your specialist will advise your future. Don't take this medicine if any of the above apply to you. If you are not sure, talk to a doctor or pharmacist before taking Depakote. Warnings. Depakote can cause liver failures that may be fatal, especially in children under age 2 and in people with liver problems caused by certain genetic disorders. Do not start or stop taking Depakote during pregnancy without your doctor's advice. Dual peroxisodium may harm an unborn baby, but having a seizure during pregnancy could harm both mother and baby. Do not use Depakote to prevent migraine headaches if you are pregnant. Drinking alcohol may increase certain side effects of dual perox. Avoid driving or hazardous activity until now how this medicine will affect you. Your actions could be impaired. Side effects. Get emergency medical help if you have signs of an allergic reaction to Depakote, hives, difficult breathing, swelling of your face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Seek medical treatment if you have a serious drug reaction that can affect many parts of your body. Symptoms may include skin rash, fever, swelling glands, muscle aches, severe weakness, unusual bruising, or yellowness of the skin or eyes. Call a doctor at once if the person taking this medicine has signs of liver or pancreas problems such as loss of appetite, upper stomach pain that may spread to your back, ongoing nausea, vomiting, dark urine, swelling in the face or jaundice, yellowness of the skin or eyes. Report any new or worsening symptoms to a doctor such as motor behavior changes, depression, anxiety, panic attacks, trouble sleeping or if you feel impulsive, irritable, agitated, hostile, aggressive, restless, hyperactive, mentally or physically, or have thoughts about suicide or hurting yourself.